Hi, I'm Dr. Sunana, and as a physical therapist, I'm gonna share some of my learning, some of my experience, what I have studied in my past, what I have studied in my course, and it's gonna be a maybe useful, some of the aspects for the many people there. So today I'm gonna share the very important topic these days. This is depression, which I'm gonna share some of the facts about the depression. So if untreated, the depression can lead to a great severity, and it could, lead to even suicide cases. 15% of the people who are depressed committed suicide every year. Depression refers to usually the feeling of the hopelessness and the great negative perception and the feeling of the loss and the grief most of the time, and you are kind of the lost from the society. In kind of the most cases, the depression may have the one or two episode of the depression, and then the person feel like it's kind of the normal mood. But if it is continue for the 1 week, 2 week, 3 week, then it is kind of the major depression. For example, the depression with the spinal cord injury patient who are really on the bedridden are the majorly higher rate compared to the other kind of the depression. So as a physical therapist, our first step is to, if the depression is suspected in any kind of the patient, so it's kind of the depression is being treated or have they any received in the treatment in the past for the depression. Patient with the less severe symptoms can refer to the the psychologist for some of the verbal therapy. But if the symptoms are really severe, then it will go to the some of the doctor referral or maybe the occupational therapist, or the some of the higher referral we could say for the further treatment and the further intervention. And the referral for the occupational therapist for a depression, they definitely can help with their regain for their life and to lead a good life ahead.